in, we ask them our questions, we get our vital signs, get our EKG, determine if it's stable or unstable, then we have to know what rhythm our patient's in, okay? So I'm gonna start off with, so let's see, we're gonna do the rhythm. Huh? Okay. So SVT is supraventricular tachycardia. It's the rhythm I just had on here. The heart rate is greater than 150. And you don't see P waves. It's not that they're not there, it's the rhythm is so fast you can't see them. Lead one. So SVT basically is, from your standpoint, is like a really super fast sinus tachycardia. And you won't see the P waves because it's too fast. SVT is very common, especially in younger people and more females. I had it for a very long time. I'm going to tell you my little story because I got to get my water. I'm going to tell you how to treat it first. So stable. So we don't have any of those over there. Our patient's stable. We're going to give a medicine called adenosine. Six milligrams IV, fast push, followed by 20 cc's of saline. mLs saline, also fast push. Next dose is 12 if we need it. So one would be 6, then it would be 12. If you get the meds and you still can't convert it, then you're gonna go to cardioversion. Yes.
Time frame before you do it?
Like 5 minutes. So the adenosine is very special because it's super short acting. Harry, please wake up or you're going to be asked to leave. So when you give adenosine, so I had adenosine when I had my problem. I had SVT for at least 10 years. So adenosine, what you like to call it as chemical cardioversion. So adenosine is a med that's going to stop the heart and it will restart in a perfect world back into normal sinus rhythm, sinus tachycardia. Because it stops the heart, it can only go through one rotation. We don't want it to keep going through. Hey, stop, start again, go all the way through the body, stop again. So, I mean, it literally has a half-life of like, it has an onset of like 30 seconds. It's gonna go through and it's gonna work and then it's done. So that's why we also have to follow it by a fast push. So you're gonna have an IV in. Usually there's a stopcock there, and there's one side of the stopcock has the medicine and the other side has the saline ready to go. So you can open it, do the fast push of the adenosine, turn the stopcock, do the fast push of the saline to get it into the heart before it deactivates itself. Does that make sense? So when you talk about it, you're giving 6 milligrams fast push followed by 20 mLs of saline fast push. Same thing for the 12, you would give a second dose if it doesn't help. That's why I'm saying like 3 to 5 minutes, because it's really quick. So if it doesn't work, we're gonna wanna give another one. If you've given the meds and it still doesn't convert, then you would go to cardioversion at that point. If your patient is unstable, we go right to cardioversion. So unstable doesn't get meds, we're gonna cardiovert. 50 to 100 joules, and increase by 50 if needed. So stable, we do meds. If the meds don't work, we would go to cardioversion. If they're unstable, we go right to cardioversion because we don't want our patients sitting around hypotensive with a heart rate of 220. If at any point you're giving meds, your patient becomes unstable, then you'll switch as well. So say you gave 6 milligrams, patient became unstable, they went hypotensive, then you're gonna go straight to cardioversion. So if at any point your patient was stable, they become unstable, then you're gonna automatically switch to the unstable protocol, okay? So when I was probably 17, 18, I started having some very short bouts of palpitations. That's what I thought they were back then. And my heart rate would just kind of go really fast and then stop real quick. And then it continued on when I was in RT school, because I went to RT school pretty much right out of high school. And I started having these longer bouts of my heart rate going really fast, and it was like, I wonder what's going on here. So what happens when SVT first starts is that people think you're crazy. Because you come in and you tell them you're having these bouts of fast heart rate, and they tell you it's all anxiety. Don't worry about it. You're fine. Especially you young female people, you're all crazy. That's what they think. We're all full of anxiety, and it's all in your head, and you'll be fine. Take some deep breaths. I'm like, all right. So as I got older, it got worse. So, which is not uncommon. And I would start to have bouts where it would go on for like 30 minutes and whatever. And so you try to get to the emergency room. And by the time you get to the emergency room, then it's gone again. So first you try to talk to the doctor. That doesn't do you any good. So then you try to get to the ER. And then by the time you get to the ER, you're not having it anymore. And they all think you're crazy too. Because once you have SVT and you have this really high heart rate, when it converts out, you're in sinus tachycardia for a little while. So when you go in, you're in sinus tachycardia. And so then they think you're just having this anxiety stuff, and you don't have. So it's really hard to catch. So they have you wear Holter monitors, which are outpatient monitors where they can check your heart rate. They have you do EKGs. They have you do all these things, and they still never see this so-called abnormal heart rate that you're having until eventually you can get it caught on a monitor, which eventually is what happened, because then I started having it for hours at a time. My heart rate was 220 to 230 when I would have SVT. So it was serious. And you can't really do anything when your heart beat's going that fast. You can pretty much just sit there. Some people will pass out from it. So eventually, once they actually saw that I was telling the truth and I wasn't this crazy lady, they sent me to a cardiologist, and he put me on medication. So that was fine for a while until I got pregnant. So I got pregnant with my firstborn, and I hadn't had any problems being on the medication. Well, shortly after my pregnancy started, I started having problems again because of the stress on the heart and everything. And SVT is really weird too, because it comes on in like these strange. Has anybody in here had it? Sometimes I see.
Sometimes I feel like it.
Yeah. So sometimes it comes up with weird times, like if you bend over, if you do something quick, you put your head down. It's really weird how it happens. But the reason SVT is caused by, you have the path the heart goes. It's supposed to go from the AV node down to the SA node to the AV node and all of that. Well, with SVT, instead of going from the SA node to the AV node, it kind of takes a detour. And the electrical pathway taking the detour is what trips it into being another rhythm and going into the SVT.